I know that one of the challenges of navigating this pandemic is that guidance changes based on infection rates and new evidence. There's also, unfortunately, a lot of misinformation out there. It's an important reminder that sources matter and that information based on science matters. Part of my role is to make the latest science understandable to the public. So if I don't answer your question today, please reach out to a trusted healthcare provider who knows your family and your needs best. We have 3 trusted sites with accurate science-based information for you below. Our hospitals are definitely feeling the pressure of the Omicron wave, and hospitalizations are increasing for all age groups, including children. It's important to remember that the biggest risk factor for being hospitalized is being unvaccinated. If your child is 5 or older, get them vaccinated. And if they're 12 or older and were vaccinated 5 or more months ago, they can get a Pfizer booster to extend their immunity. The coronavirus vaccine for children younger than 5 is expected this year, although there's no set date. They are currently undergoing rigorous clinical trials to ensure safety and efficacy. Whether your child is vaccinated or not, get them tested as soon as possible. They should quarantine until they test negative and symptoms resolve. Contact your local school district or visit the link below to find a testing site near you. If you test positive, you should isolate for 5 to 10 days. Day 1 is the day after your symptoms start. So if you develop a cough or a sore throat or runny nose on Monday, day 1 is Tuesday. If you have no symptoms, day 1 is the day after you test positive. You should test again on day 5. If you have no symptoms or your symptoms are improving on day 5 and your test is negative, you can exit isolation. You should continue to wear a mask around others for the next 5 days. If you test positive on day 5, you should continue to isolate for another 5 days for a total of 10 days. After that, you can exit isolation, but you should continue to wear a mask around others for another 5 days. To help make it simple, we made this flowchart that you and your family can refer to at the link below. If you are experiencing any of the following symptoms, difficulty breathing, pressure or pain in the chest, bluish lips or face, confusion or difficulty waking, or any other serious symptoms, please call 911. First of all, it's okay to take a moment and recognize that some things are out of your control. The goal is to focus on what you can control. If possible, the infected person should avoid contact with other members of the household. Designating a specific sick room or area can limit the spread. When sharing spaces is unavoidable, everyone should wear a well-fitted mask and open windows for better ventilation. Airflow really makes a difference. Washing your hands often and using hand sanitizer, as well as disinfecting any surfaces touched frequently, can also limit spread. We recognize that it's really tough to separate yourself from your household, and it isn't always possible. But these tips are especially important when someone in the household is unvaccinated, has a weak immune system, or is at higher risk for serious COVID-19 illness. Anyone exposed should get tested as soon as possible, even if they have no symptoms. Visit the link below to find a testing site near you. First, know that if it feels hard, it's because it's hard. We are navigating through a once in 100 years pandemic. And if it feels exhausting and difficult and overwhelming, that's appropriate. I personally use meditation to help me stay grounded. And there are other evidence-based stress busters that we can all use to regulate our stress response, like looking to our nurturing relationships with those who are closest to us, eating a healthy and balanced diet, creating habits and routines that we can control and rely on, right? A predictable schedule. And this can be as simple as going to bed and waking up at the same time every day, or practicing mindfulness like yoga or prayer. Don't underestimate the power of being in nature. Pack up the family and go take a walk in nature. Finally, ask for mental health support when you need it. The CalHope Warm Line offers safe, secure, and culturally sensitive emotional support for all Californians at 833-317-HOPE. I hear this so often from parents right now. Know that you are not alone. Believe it or not, step one is checking in with yourself and taking a moment to regulate yourself so that you can be a source of stable support for your child. Start by validating their feelings and let them know that you're there for them. Talk to them about what they're feeling, ask questions, and remind them that you'll get through it together. If you need someone to talk to about how you are feeling, call the CalHope Warm Line at 833-317-HOPE.